So welcome everybody. We're here to in a segment called Baseline with Boss. My name is Tracy Barill. I'm one of the senior educators with SkillStat Learning. Michael.
And good day, everyone. My name is Mike. I'm another educator with SkillStat and a paramedic by trade, and probably I consider myself a healthcare educator for the last 15 years or so.
And we teach and we facilitate experiences that fit nurses, paramedics, physicians, respiratory therapists, dentists, and a number of other allied healthcare professionals. And when we're dealing with emergencies, we often like to bring it back to really the brass tacks. You know, where does this all begin? And sometimes what I do is I just put a word on a whiteboard like that word, you know, life. All right. And I just put that there. And it's like, this is what we're trying to keep going. Right. And when emergencies are occurring, this is being threatened. So when we want to start off with emergency, the first thing maybe just to know is what usually drives this? What makes it happen? What keeps it happening for the number of years that we are living so far? And you bring this back and it actually comes out that energy is required in order to life to continue. And when it comes to that, right, in fact, we can even put it, you know, just to hold on, I'm going to put this into something called ATP, because that's actually the energy molecules that most of us use for any reaction that occurs across 30 trillion cells in our body all at the same time. So, and in order to get this, what we're saying is that this boss is needed. And that boss falls as blood, oxygen, sugars, and salts, right? So those four aspects together produce the amount of energy that we need in order to live. Now I'm looking at Michael right now, and I'm not even sure that he's breathing right now. All right, I think he is. All right, but I know he's smiling. I know that he needs to breathe in order to get life. I know he needs to have, like, look at those peak cheeks. He's got oxygen going. He's got blood going. All right, he's got enough sugar. He's probably eaten today already. Is that true, Mike?
It's true.
Okay. All right. And I tend to want his electrolytes, his salts, are actually in a good status, probably a nice equilibrium in through him. And when he has those three, in particular, you take that and bring it down to a triangle: blood, you know, carrying oxygen, you know, and, you know, sugar. I'm going to put it just even more specifically as glucose, but the sugars, if you bring it just to those three, you're going to find that those three really get the job done. Because when we have enough blood coming and we have enough oxygen in that blood and we have enough sugar in that, well, we'll end up with enough energy. And the ATP, what we end up finding is that 6 oxygen, 1 glucose yields, 36 is a number, ATP. The point being more so, it's enormous. Now, we can generate energy without oxygen too. And that's probably important to know too, is that when you don't have oxygen, that you can generate ATP as well, but now just 2 ATP plus a whole bunch of acid, right? Not exactly the most efficient reaction around. So you want energy, you want enough energy, you want your people that are coming in, and you're a healthcare pro, and you want to be able to recognize when someone's in trouble. 10 to 1. This is going to be one of the 3 areas or more. Could be 2 of them working all at the same time, but these are your trouble zones. So think about this. A person comes in with a decent blood pressure, 118/72. They come in with a SAT of 98, but the sugar's in their boots, right? How energetic are they going to look? Mike?
They're not going to have enough energy to do what needs to be done.
Right? Could they be unconscious?
For sure.
They could be. All right. You know, or let's say the SAT, oxygen level is 98%. All right. And the sugar is great. Right. And the blood pressure is only 66/44. They could look energetically exactly the same as the first case. And then in the last, you know where I'm going with this. All right. We got the sugar that's great. We got a blood pressure that's really good. And O2 SAT is 64%. It could exactly the same. And all these 3 are the ones that we start to look at. So if you're one of those people like us, that if someone comes in and they're not looking that good, 10 to 1, what you're recognizing is they have some challenges to their energy. And then the next question is, what are the challenges? So at the very least, when someone comes in, you're going to want to be able to, you know, check their blood status. All right. One of the best ways to do that is with a blood pressure, or maybe if the person's a little younger, maybe with a capillary refill, right? Check that cap refill. And if you check a SAT, you're going to check an oxygen SAT, and you want to check a sugar, right? Because that's going to get you a good start on how your patient's doing and where is your priority interventions need to be, applied, right? So this is where I wanted to start with this with BOSS, and salts we'll get into in another segment, but today we want to focus primarily on the blood, the oxygen, and the sugars, right? And what does this mean? Now we're going to bring in a number of examples, because I know that Michael and I, when we teach courses like ACLS, Advanced Cardiovascular Life Support, or Pediatric Advanced Life Support, or Basic Life Support, which is the foundation of them all, particularly when someone is that in trouble, right? What we often like to do is still come back to why do we do things? Why? Not just what. Because the problem with what is you can't keep it in our head for very long. We need the big picture. And the big picture for us comes down to primarily these things. Now, salts got to keep in mind, but today we're going to deal with the first three, blood, oxygen, sugars. Now, in many of our courses, what we deal with is people that are going, way too fast. The heart rate is going way too fast. Or sometimes the heart rate is going way too slow. Or something that we refer to as HATs, which we're going to get into. But these are the three main areas that we're hunting, right, for, and particularly in all of those areas of heart rate too fast, too slow, we're thinking blood, is it oxygen, is it glucose? So Mike, right, there's a start on things, all right? I did use numbers, right? I almost apologize, but I won't, all right?
That's good. Yeah, we can stop it there. Yes.
All right. Where would you take it from here?
As you can imagine, thinking as we go through you might want to break it down into you guys do this already. I mean, think about it. When somebody comes in and they're in trouble, what do? Well, we look at their blood. Well, how do we do that? Is there enough of it? What's their heart rate? Are they pumping it well enough? What's their blood pressure? We do all this stuff already. Then we go and look at oxygen. Are they breathing? What's their rate? What's their O2 sat? This is stuff that we all do. We just might not think of it in this sense. And then somebody, I guarantee, is going to check a sugar if someone's sick. And we're going to find out it's high, it's low, it's normal. So this is all done already by everybody out there. It's just this frame kind of gives us a simple approach to remembering kind of how to go about this and how to kind of break it down into something that's really simple. So I think that's kind of maybe a step to break it down into, this is not something that's foreign.
No.
It's something, it's a way to break it down so it makes sense, and it's real, and it's your priorities,
Like you're calling out the strength of what we already do.
That's right.
Bringing in just why we do it and just perhaps double down as to the importance of this.
Yeah, and really then noodle in kind of like when we say the word blood, what does that mean? It means heart rate, it means volume, it means pump power, and it means systemic vascular resistance too. I mean, it means all those. When we say oxygen, it means it means breathing rate, it means O2 saturations, it means the ability for oxygen to get to the lungs. So it means airway, which is again stuff we all do already. And when we're talking about sugars, I mean, pretty straightforward. I mean, it, generally, and just remind them, I mean, sugars are not necessarily going to be going to kill people, but definitely if they don't have enough sugar, they're certainly going to struggle to make enough energy to do all the things you're going to want them to do here. All the compensatory mechanisms, all the recovery stuff's going to need energy. And so making sure that sugar is in a good range is going to be a priority, which it is in everything we do.
Like if we take that triad of blood, oxygen, glucose and try to unpack it.
Yeah.
If we just stuck with blood alone, right? I often, and I think we both do, is you mentioned blood and look at how do you script that in your head? And I
Yeah.
often think about how much volume a person has.
Mhm.
Is it flowing? Is it actually moving to the cells, right? And is it moving enough? And then the aspect of where is it hanging out?
Well, it comes back to rate, volume, pump, right?
That's right.
Distribution really is what it comes down to again, right? In that order kind of thing,
Mhm.
which again is what everybody does, but they kind of don't do it in a organized fashion. Kind of they're all over the map, kind of checking a rate over here. Then later they get a blood pressure, but not really connecting it all together. They're just like they're reacting to it kind of, quickly, and not really truly understanding why do we need to get this rate up? What's the big deal? Well, the big deal is the possibility of creating 15 times more energy. So this person can recover, can look after themselves, and they can, your body can do a lot of things with that much energy. Yeah. So yeah, it's just bringing that back to the real of it all, like, and then making it simple for them. So think about it when the next person comes. Is there anything that we're missing out of here? Is there? I mean, blood, oxygen, glucose. Is there anything that we've left out? Some of us might measure end-tidal CO2. Well, that'll give you an idea of whether you're actually any of this is creating energy, because without this working, you're not getting a whole lot of necessarily. If your breathing's not working, maybe you're not getting enough CO2 back, or I don't know, you can delve into that a bit. That might be getting off into the weeds a bit, maybe. But yeah.
So if you wanted to like bring examples, and I mean, Michael, you're a paramedic, right? You've been working in the air. You've been working in a titanium box for more than 15 years, right? Big U in a little box. I always keep that in mind, right? But you're up there in the middle of the air with just you and maybe another person or two, and then me as a nurse, we're often in a hospital where if you're in a hospital with all these people, we're in the air, you're with just a few, right? Or it might be just one, right, with the patient. And when you're coming down to just what's needed at the moment and what are you capable of, when we bring things back to these three things, blood, oxygen, sugars, and salts, right? But bring these things up to back it down to three, then you can start to identify that sometimes the most rudimentary interventions make all the difference, right? So like an example, whether you're up in the air or be down in maybe a bigger center with more people. Let's say we have a person that comes in and they're just with you, and all of a sudden they start to look less energetic. Right. Well, 10 to 1, you have them on a monitor. You've got a number of things monitoring, looking for why are they less energetic? True. You probably have them on a monitored defibrillator or some sort of monitoring system. You might be measuring CO2 levels. You'll be looking at an ECG that'll be telling you heart rate. And let's say that normally their heart rate was going at around, they were in trouble, right? They were in trouble. Right. And in fact, they were in trouble because their fever was high and you were thinking that they were in a septic shock. They already had an enormous infection brewing. It's one of the reasons they probably called you. And you had to go up to small little spot up in northern Canada and pick this person up and get them to a big center so they can get treated for their infection. That sound about right?
Mm-hmm. Yeah.
And up there, they had a heart rate, you picked them up, a heart rate of 118. And so that's where it was. That was the heart rate. And, they were, and they had a blood pressure of, what was their blood pressure, Mike?
Blood pressure, 108 on 65.
Okay, so 108 on 65. Were they conscious? Were their brain, giving you full sentences and the rest? Were they giving you all that?
Semi-conscious, confused a bit.
Right. So we had some sort of semi-conscious, so we have that, and boy, now I have to actually without a spell check. All right, so these are your three main things. That's enough to get this story going. And we know that when she is firing at 118, it's because her heart's trying to produce more blood flow so that there is more energy to deal with this high infection that requires more energy. True.
Mm-hmm. Yep.
And when we think that, and I often think about, how much you should be pumping per beat, and most adults is somewhere around 50 to 80 mils, but we're going to give her 100 because she probably has a lot of adrenaline going on. We know she does because her heart rate's picked up to 118. And that means that she's pumping somewhere close to about 12,000 mils of blood per ventricle per minute. Amazing. Agreed? And that's
Agreed.
what's going to give her enough energy to sort of try to compensate, right? So she's still maintaining a bit of a blood pressure. Her O2 sat might have been just fine. Her sugar, adrenaline makes the sugars mobilize too. And then in the middle of this, unfortunately, her heart's been working too hard. She's a little older. She's got maybe a little bit of coronary artery disease. And she shifts from 118 and she goes to 220. Right. And, Mike, when you're thinking this as an example, and then how much do you think she's pumping out per beat?
Not that much.
Not that much. Let's say, should we be generous? Right? Should we give her maybe 5 mils? Right? Something like that, which should give you somewhere, about a 12th of what she would probably be giving. So, about 1,200, right? About 1,200 or 1,100, say 1,100. I'll put a dot there. The point is how energetic is she going to be with only 1,100 mils, right? So are you going to be terribly surprised that she's nowhere near as energetic now when she hits 220?
No. And this is historically, where it comes down to it now. What's her priority now? Is it, so this lady needs antibiotics. She's gonna need some bring her fever down if she has a fever. But is that going to achieve, like right now, she needs more energy.
Yeah.
And to do that, we got to go through the blood oxygen glucose that needs to be resolved. And so our vital signs will give us some clues.
So I'm looking at this and I've got a heart rate that's going way too fast. And this is unlikely to be related to oxygen all by itself or sugar all by itself. This
sugar's good. Sugar's 7.9 millimoles per liter.
Okay. All right. And now we're actually at a point where our energy is tanking. And we have to think about what's your most important. So we recognize energy's tank. One of the most important areas that our energy that watches her level of consciousness. And now she goes from semi-conscious to unconscious. All right. We do everything we can. We're trying to find a pulse. Do you find a pulse, Mike?
Weak pulse. No
weak
pulse.
All right. So you got a weak pulse going on. And you're thinking, okay, now we got this going. And our energy is really, really low, right? I actually, if I'm working with you that day, boy, that'd be a really tight plane, let me tell you, right? And I'll be trying to bring her airway in and give her as much oxygen as I can. But I know that's not going to fix this problem because this problem is a blood problem. And this problem is a blood problem because the heart rate is going way too fast, which doesn't give enough time for the ventricle to collect blood, and energy is impacted significantly. So our best solution, I know, for you and I would be to fix that and fix it now. Now, there are times that people go in the bigger centers where you got all these people around, like might say, let's get ready to maybe cardiovert her, shock her out of 220 back to maybe 118. That might be a thing. And meanwhile, if there's all these people around, they might say, and upper fluids. All right. But of those two, where should the focus be? Because you're in the plane and there is just you and the other person's managed the oxygen, and you got to be thinking priority. What is your priority, Mike? If you're up in the plane, is it volume?
First priority is slow that down.
Okay.
Second priority is have some volume ready to go because she's probably going to need some.
There we go. So you're probably already giving volume because of the nature of sepsis, and you shock her from 220 down to flatline, which allows the sinus node to take over now in that spot where the ventricles aren't going way too fast. Then we come back to 118 again. And then we have enough time for the fail, and eventually we get back to 100 mils again. And we get back to 12,000 mils again. And then for the moment, right, she's in a better state again. And over the next minute or two, she may even start to wake up again. True?
True. And it's not really, we're not the real heroes here. We've just allowed her body now to make 15 times more energy. I mean, it's going to be able to do what it needs to do for a little while longer now. And that's really the bottom line here.
Now, if she starts to wake up and then in the middle of this, she starts to lose consciousness again, again, we'll probably go back to these three quadrants, the primary ones, or three quadrants. That's nice, right? But the three pieces, so it'd be the blood, oxygen, glucose, and we get into that, and it's like, well, we're checking out. Well, sugar's unlikely to lose that. She got volume coming in, maybe with some sugars, maybe there's that going on. But we also have, what's going on, and then instead of maybe 220, we also see that, her oxygen level starting to fall. Right. It was when she first came in, she had an infection. We didn't even know quite where. But now when we listen to her lungs, it's like we're thinking that it's that way. Right. And she's not as conscious, and we're starting to see oxygen starts to tank. We look at her oxygen sat now down to 84. Right. So 10-1, you're going to probably try to, bump that oxygen up. And let's say we get it up to 95, 96 again. Well, you'd expect your level of consciousness to be. It's going up too. So you're thinking in the end, you and I mean, this seems all simple, right? It is simple, right? None of this is all that complicated, but we know that these too fast, too slow is definitely an impact on blood flow and energy, right? And then we think about hats, other groups talk about H's and T's, but we're also thinking anaphylaxis, where blood's there, it's just not in the right place. It's down in your boots and your hands, or sepsis, where the blood's there, it's just not in the right place. It's down in your boots and your hands, stroke, and then these H's and T's. And then between this, it all fits within the energy triad, right? Where's that? And within the energy, we can actually go after this. You got a tension pneumo, that fits within the T's. Right, you got this big balloon inflating in the pleural space on one side, probably. Right, so that sound complicated, Mike? Super complicated. Big balloon, right? Big balloon actually impacting the lung, but more importantly, pushing against the vena cava. So now you don't have blood returning. So what do you want to do?
Got to fix it.
You got to fix it. All right. Now Chris is not a healthcare person, but I know Chris, she's looking at us. It's like, she's probably wants to take a needle and blow that balloon, because she's always probably want to do that as a kid too, when somebody's else carrying the balloon around. So you're going to push that balloon, you're going to take a needle, and we're going to blow that balloon and allow that pressure to subside, and the vena cava will not have the pressure on it any longer. Or if we have someone that has a huge MI going on, acute coronary syndrome, where we have a vessel that is occluded, right? Now we have problems with energy to the heart, but more so is that this heart muscle will start to falter if we don't deal with it soon. So if your problem is a clotting vessel, then I know that sounds pretty simple to actually get at that vessel. So we'll go after with aspirin, probably go to the cath lab. Or if you're in a smaller center, or you're up on the plane, do you have some big guns up on the plane, Mike? Like things that work even faster than aspirin?
I don't know, on the plane. No, probably not.
But once you land it, even if you land in a small area, you probably will bring out maybe some fibrolytics, because it works that fast.
Yeah.
The point is that we can come back to this. It's like this. If you look at this, this is, that's about 30 different algorithms. But if we think about these 30 different algorithms based on energy, blood, oxygen, glucose, and salts, because by the way, one of the H's have to do with electrolytes, too much or not enough of. We come back to this and go after it that way. Right? And then we quickly identify what's the most important thing we can do right now. It's a way to recognize emergencies early, see movements from normal early, and then deal with it early and not allow them to arrest, which would be the best success out there.
Well, when you think about it, right, it all comes back to, at the end of the day, it all boils down to blood oxygen, glucose. And you can't rule out salts, like you said, but in reality, we can't measure those quickly. They're not unimportant. They're really important. But we're going to be focusing on the blood oxygen sugar, and then we're going to be finding out eventually what the salts are, what the electrolytes are, because that might be part of the story too. But yeah, everything we do in emergency medicine boils down to this basic concept.